Hello, my name is Jennifer Hammond, and I'm going to present to you my evidence-based practice poster on prevention of central line associated bloodstream infections. Facilities and nursing units that will benefit from this information include acute care hospitals, long-term acute care hospitals, ICUs, skilled nursing facilities, and even home health agencies that provide IV infusion therapy. The patient population affected by this information is any patient that has a central venous line or CVL, including midline catheters, PICC lines, and even Mediports. The purpose of this investigation was to determine how we can decrease the rates of central line associated bloodstream infections. It was once thought that these infections were unavoidable, that patients got these infections simply because they were high risk for infection related to long-term IV access. However, a multitude of studies have been conducted to show us that we can prevent these infections and decrease the rates of CLABSI using evidence-based practice when providing care and maintenance for CVL sites. The first study that I found on that implemented guidelines to decrease the rates of CLABSI was in the ICU unit. They had a sample size of 78 patients with CVLs. The study was conducted over a 3-year period. It was a quantitative, descriptive, retrospective design. They analyzed the rates of infection prior to and post-implementation of the Society of Healthcare Epidemiology of America's guidelines on CVC care. And they noticed that their rates of infections decreased from 1.9 per 1,000 catheter days to 1.3 per 1,000 catheter days. The second study I found was conducted in a 210-bed hospital in the ICU unit. This was a prospective study. They did a literature review and found 5 hospitals that had implemented successful CLABSI reduction programs. Using the Infusion Nurses Society and CDC guidelines for central venous catheter care. The 3 most common components of these successful programs included daily surveillance of CVC sites for signs and symptoms of infections to make sure that to check the dressing integrity and also to audit for the need for these CVCs. Prior to implementation of these guidelines, their rates of infection were 1.068 per 1,000 catheter days. Post-implementation, they reached a near zero incidence of CLABSI. Their rate was 0.3048 per 1,000 catheter days. Finally, the last study that I found involved 30 long-term acute care hospitals. They implemented IV catheter care bundles, and this was a pre-test, post-test, quantitative, experimental design. They assessed the rates of CLABSIs prior to and post-implementation of these catheter care bundles. They too found a significant decrease in the rates of CLABSIs. All of these studies included using evidence-based practice while providing central line care and maintenance. Notice that I have hand hygiene highlighted a couple of times. It's because the number one thing we can do to prevent the spread of infection is proper hand hygiene prior to caring for these CVC sites. This includes hand hygiene prior to accessing sites. Also, we need to make sure that we're scrubbing the sites with alcohol prep, cleaning them before accessing them. And also, each of the guidelines emphasize maintaining aseptic technique while providing catheter dressing changes. Also, they emphasize scheduling dressing changes every 7 days and not changing the dressings too often to prevent exposure to the environment. In conclusion, when we use evidence-based practice that includes hand hygiene and using aseptic technique when caring for central venous line sites, we can significantly decrease the risk of infection in the patients that have long-term IV access. Thank you.